A very good evening, everybody. My name is Atif Moiz. I'm one of the consultants in emergency medicine based in England, also from Hyderabad. And join me today is Dr. Aman Saeed, who's one of my colleagues who also works in England. So we are here today presenting a simple talk on leadership in emergency medicine for stakeholders. So first of all, I would like to brief you about what I've done so far in emergency medicine. I did my membership of Royal College of Emergency Medicine from Apollo Health City, Hyderabad. Following that, I did join Star Hospital as consultant and head of the department for about 2 years. Following from there, I joined AIG Hospitals, Gachibowli as head of the department. After that, I had this opportunity to do the fellowship of Royal College of Emergency Medicine training in England. So I went over to England, joined as a higher specialty trainee, that is ST4, ST5, ST6. Finished my training or residency in emergency medicine, obtained my certification of completion of training. Following that, I still work as a consultant in emergency medicine at the Mid Yorkshire NHS Trust. This is in a place called Wakefield, which is quite close to Leeds. In terms of leadership, I look after the CSER in emergency medicine program. CSER is Certificate of Eligibility for Specialist Registration. So I'm the lead for that program in my department. What it means is basically the doctors who are from overseas, who are not able to get into the structured training program in England, can, prepare their paperwork, can develop their portfolio on par with the likes of the trainees, and then submit it to the GMC to be able to be recognized as a specialist on the specialist register in GMC. So that's my experience. And throughout my journey, the leadership has been a very fundamental thing for me. And it is for everybody in the field of emergency medicine. And I would like to take this opportunity to thank Yashoda Hospitals, the team, the emergency department there, for giving this opportunity to be able to speak to all of you, and also to the SEMI board, the national board, all the members of this organization. Thank you very much for giving this opportunity. I would like to pass on to Dr. Aman Saeed, who is my colleague for today's presentation. Thank you.
Hi, yes, thank you so much, Dr. Atif, for introducing. And again, thank you so much again, everyone, for the wonderful opportunity. My name is Aman. I'm one of the emergency medicine trainee here in UK. I'm currently doing my final year of training. Soon, hopefully, would be completing my CCT, what is called as Certificate of Completion of Training here in UK. Like Dr. Atif, I started my journey in India, did my emergency medicine training in Apollo, then moved into other healthcare sectors. Sorry, the other hospital, which was Care Hospital. Then in 2017, I came to UK, and since then I've been here pursuing my fellowship. So I'll start sharing my screen so that people can. Okay, so I hope my screen is visible. So yeah, so today's topic is about leadership in emergency medicine. I have some personal experience with leadership. I was selected for a 1-year fellowship program here in UK, which is a competitive-based selection process. So I was doing multiple projects on leadership here in the UK. And during that period, I also have completed a PG cert in medical leadership from Lancaster University. So it has given me a lot of insight into what leadership actually means. And one of the reasons I joined this program is to identify my leadership skills and what exactly leadership means. Because in my own head, I had a very different definition of what leadership is. So today I'm going to just share a few of my experience, and we will talk about what exactly leadership is and how it should be pursued, not just by people in position, but for everyone. Like Dr. Atif mentioned, it is equally important as a clinician when you're growing. You have to have some leadership skill, especially in emergency medicine. So moving forward, okay. Atif, if you could just ensure that my screen, my slides are moving.
Yes, they are moving. Thank you.
Great. So this is a bit of rollout I wanted to do is about what does leadership mean? I think it means different things to different people. So I was hoping if we could get some answers. I think we'll move forward. Anyway, so leadership, why it matters in emergency medicine. Emergency medicine is a very complex specialty. It involves dealing with a lot of other specialties, and it is at the forefront of any healthcare system. So, in a nutshell, as an emergency medicine doctor, it is extremely important to have communication skills, to have leadership skills, to have managerial skills when you're growing as an emergency medicine physician. Like I said, emergency medicine is just not about clinical practice. As you can see here, it's not just about doing invasive procedures for the patient, but it's also about managing the whole department. So you have a lot of uncertainties, you have complex teams that you work with, you have a lot of system pressures that you have to deal with. So it's, again, like I said, it's highly important that you have the right skills to deal with all these situations in the same time. So, what will be your takeaways from today? So, as an emergency physician, like I said, you have to be a coordinator. Okay, you have to coordinate everything for your patient. You will have multiple teams. You have to deal with other specialties, different work personnels, and you will have to coordinate everything to ensure that your patient is receiving the best care possible. So, recognizing leadership in everyday clinical practice is one of the key takeaways that I hope that you guys take away from today's session. So, leadership is not a position, it's overall a journey. Okay, so it's not like that you attain leadership when you reach a certain position. It's your journey. You will have to understand yourself, your team, the system you're working with, and how you can build and shape culture. So in today's session, like I said, we will be understanding how to lead yourself, what it means to lead teams, what it means leading systems, and how you can shape culture. So I think for me, this is very important. For me, the initial question which I asked, leadership is about building culture. If you could build the right culture as a leader, the team follows, and then slowly, the system also follows the culture that you have developed. So I look at leadership as a tree, which you have roots, which is your foundation that comes from your values, with your beliefs. The next important aspect of that tree is the trunk, which is you yourself as a physician or as a healthcare personnel. That is the core of what you are. So it's highly important that you know how to lead yourself. The branches is your team. So the team which you're working with, you might be working with an ICU team, the surgical team, the medical team, cardiologist, orthopedicians, trauma team. So you get involved with so many different specialties, and they kind of form your branches. So you need to know how to deal with your teams, how to build relationships, communicate effectively, and work collaboratively to support your patient care. And obviously, the final part is the canopy or the fruits. Once you have built a strong root with all other parts, you have a nice blossoming tree which will yield you the right fruits which we are all craving for. So the first part is about leading self. Like I said, it's if the leadership is the influence, the first person we must learn to influence is ourselves. So if you don't know how to lead yourself, you don't know how to conduct yourself, you don't have self-awareness or self-management skills, then it is very difficult to manage the teams that you're working with. So moving forward, like I said, the roots, these are the basic foundation of anyone. I think as doctors, our basic value is our patient care, our duty towards our patient. So that is something very deep value that all the doctors, physicians, or for that matter, anyone working in the healthcare sector holds up. Uh, Again, different people have different values. There's no set of values that needs to happen, but I think the key ones for me would be integrity, humility, compassion. It is vitally important because you're dealing with patients in their worst situation. So they are possibly in their they might be having the worst day in their life, they might be having the most difficult news to deal with. So you have people, humans in their very difficult time, and they are interacting with you, they are dependent on you, they're looking at you to help them. So I think compassion, empathy is one of the key findings that you need to have. Accountability, vitally important. As physicians, as doctors, we are responsible for somebody's well-being, somebody's health, and in a lot of situations we might be responsible for someone's life and death. So accountability to your actions, I think, is very important. So when you're building your roots, when you're building your core system of values and behaviors, these are some of the key, at least for me. Moving forward, so how would you identify your values? Okay, so basically there is a well-known concept of iceberg model, uh, which the behavior, our communications, our decision making is just the tip of the iceberg. What lies beneath the water is what I have just described. It's your values, it's your beliefs, it's your identity. Like I said, for us as doctors, we have this duty of care towards our patient. Emotions, our previous experiences. I think everyone is have their own experiences of how they have become a physician, how they have become a doctor. A lot of you might already be in a very high positions, so you have lots of experience that you have carried throughout your career, and all those things shape your behavior, what other people can see, how you're interacting with other people. The next aspect, like once you've identified the roots, the next aspect to identify, like I said, is the trunk, which is yourself. So how would you lead yourself is something very important, and I think something which is not very which is not discussed a lot uh, in the leadership concept. So leading yourself is very important. We all think leader is somebody who holds a high position and who is like commanding the people around them. But again, before you get into that position, what you have to do is you need to know how to lead yourself. So the four key aspects of leading yourself is obviously self-awareness. So you need to know who you are, how you can improve yourself, how how you can take, how you can give, provide reflection to yourself, and also take feedback from other people. So that self-awareness is very important, which we are going to talk in a minute. Then you have the self-management, again vitally important. You need to have the growth mindset. Okay, so you need to be a student for your life. Like everybody says, once you're a doctor, you're a student for your entire life. So your learning never stops. So you always should be striving to learn more, to grow further. So that mindset is very important. So you need to humble yourself. Then obviously resilience. I think this is not spoken a lot again. It's vitally important. Resilience. We know how difficult the healthcare sector is becoming, how challenging a life of a physician or a doctor or a healthcare provider is. So you need to know how you can build resilience, how you can cope with the pressures, with the challenges, and come out strong. So this is one very famous model. It's called Johari window, which is where your self-awareness will expand. Okay, so this model was developed years ago. Uh, it was developed by two people called Joe and Harry. So together combined, it is called Johari window. It's a very simple model, but I think it's very interesting, and it tells you how you look at yourself and others. So basically, the concept is that people have these four windows. Okay, so you have an open area, which everybody knows, like what we are interacting right now. This is my open area, the way I'm sitting, the way I'm behaving, the way I'm dressed, the way I'm speaking. This is all what I'm showing to the people. So this is the open area that we interact with colleagues around us or people around us day in and day out. Okay. Uh, then you have the blind spot, which is something which others can see, but I can't see myself. So probably the way I'm speaking, the way I'm conducting this webinar, the presentation that I have made, according to me, it's an excellent one. But the hidden part is I don't know how other people are perceiving it. So that's your blind spot. How would you expand that blind spot? Is through feedback. You want to take feedbacks from people. That's why we have the feedback forms that we do these days. You want to speak to your colleagues, your friends. You want to speak to your seniors, your mentors, and take feedback from them. Okay, constructive feedback to understand which areas you can improve, which areas needs further improvement, uh, something like that. The third window is called the hidden area. So this is the hidden area where I know what my things are, but I'm not showing it to other people. Okay, so I'm hiding it from other people, right? So one of the most common things, we do this because of trust. So if you're not trusting somebody, obviously we will not be sharing everything with them. We'll be hiding certain things. Like for me, with Atif is my very dear colleague. So I trust him and I share everything with him. So this is how you do that. The the other fourth aspect is the unknown area, which is not known by you and it is not known by other people as well. So the key thing here is what we call as hidden talents or untapped talents for people. Okay, so before uh, as clinicians, obviously we have the clinical expertise. We feel that we have gained enough knowledge to be a good clinician, but everybody have some hidden talent. They might be similarly like a leadership skill. You might be a leader, you might have good managerial skills, you might have good administrative skills, or you might have other sporting skills that you are not tapping into, not exploring. So the key idea is of the Johari window is to expand this open area. You want to expand this open area, explore the blind spot, share your hidden areas with people who you trust, and tap into the unknown area, tap into your hidden talents that you can utilize. So that's one angle of looking or improving your self-awareness. But again, like there are multiple concepts or similar ideas. This is one of them that I feel is nice, which I'm sharing. But again, like I said, there's a ton of information available on how you can improve your self-awareness. moving forward, so next aspect is what I said is the self-management. So when you are leading yourself, after self-awareness comes self-management. And this is one of the very famous concepts introduced by Daniel Goleman. He's one of the pioneers in this leadership field. So he talks about emotional intelligence, right? So we all know about IQ. He labeled this aspect as EI, like emotional intelligence. So what it involves, again, like I said, self-awareness, self-regulation, motivation, empathy, and social skills. Uh, so basically, this model tells you how you interact emotionally with other people. Okay, so our interactions are emotions that we are sharing with other people, right? So you need to understand how other people might have their emotions. Okay, so when you are, let's say you are speaking to a specialist for a referral, uh, that clinician might come out as that he's a bit rude, he's not accepting your referral. We have all faced that situation, right? So when you're trying to refer patient to other specialties or get other specialists to help you with a patient, you might receive some pushback, you might have received some negative comments, or what have you done, you have not done this, you have not done that. It's very common, but the problem is we don't know what they are going through, their emotions. They might have a very tough day, they might had a very busy day, they might be having some problems in the family, he might not have eaten food, they might have not rested, so we don't know what their emotions are. So trying to understand people from their emotions is what this concept Ryan tells you. So emotional intelligence is understanding your own emotions and also understanding others' emotions when you're interacting with them. So this really gives you a like an important insight into how to deal with people. The other thing what we were talking about was the resilience. Like this is what the concept it says, the leadership reservoir. Okay, so we all have our limited capacity, right? We are not unlimited. We are humans. We have limited capacity. We might yeah, exactly. So we might be busy with our work. We might get exhausted. We might get tired. So we are humans, right? So these things do happen. So you need to understand how much your reservoir is. What is the capacity of your reservoir? Obviously, you have it's a dual. It's just like a water tank. You have the inlet and then you have the outlet. Outlets would be having conflicts, fatigues, busy departments, difficult conversations with your colleagues. So all these things will tap into your reservoir and it will drain you out of your capacity. Okay. Uh, the areas that you need to improve, obviously, you need to have a better sleep, better work life balance. That is very, very important. I think doctors are known to have the worst burnout rate, and especially in doctors, emergency medicine, emergency as a specialty is well known to have high burnout rate. I think the recent GMC survey have said that the burnout rate in emergency medicine physicians is up to 60%, above 60%. It's a very high burnout specialty. So you need to know how to restore your balance. Like I said, reflection, mentoring, exercise, having a purpose, isn't it? That's one of the key. Why? What is driving us? What is motivating us to keep doing things? So having a purpose in life, obviously, family and friends. So these all will help you refuel your uh, reservoir. Yes, Dr. Atif.
Aman sir, I was going to say in that refill factors, the second one, reflection. It is such an important thing, reflection. I think um, with the training or the practices being followed, I think as leaders of departments in India, we should specially emphasize the concept of reflection. Um, It
Absolutely.
is so very important as part of the Royal College of Emergency Medicine e-portfolio that people, the trainees need to reflect, and I think we should emphasize on this because it gives a sense of satisfaction, sense of self-confidence when people reflect and think about how things went through at that situation or that point in life whilst working in the ED. It is a really important factor. And on a personal note, that really helped me improve my way of work in any sort of like a coping mechanism when things go out of hand, when the unexpected happens. So reflection is something I think we should promote this quite often in talks of emergency medicine. Thank you. Back to you, sir. Thank you.
Yeah, absolutely, Dr. Atif. Couldn't agree more with you. Reflection is vitally important, and like I said when we were discussing about the Johari window, that's one of your way to uh, get your window wider. So if you reflect on what you're doing, what others are doing, what feedback they're providing, and if you reflect on those feedback, you are just will improve. It will improve your self-awareness and it will help you manage yourself well. Okay, so that was the part one of leading yourself. So we discussed about how to lead yourself with self-awareness, self-management, having a growth mindset, and the fourth one is resilience. How would you build your resilience, and how would you uh, increase your reservoir, the capacity of your reservoir, or how can you keep refilling so that you're not draining it completely. So moving forward, the second part is obviously once you understood how to lead yourself, the second aspect is about leading teams. So this is the most important aspect, isn't it? So you are emergency medicine is a specialty which is a team specialty. It's a team game. Okay, no single doctor or a nurse or any other specialist would be able to manage without having a right team. For example, a very simple example, we deal with cardiac arrest situations or resuscitations, which is all about team working. So how would you manage your team? So obviously when you are working with different teams, you have different issues. You will face different issues when you are working with different people, for that matter. Even in your friends or family, you might have noticed different people have different ideas, different concept, different values, and how would you interact with them will form your team. So like I said earlier, so this becomes a part of the branch of the tree which we're talking about. So over here, you want to build relationships with your teams when you're working with different specialty, surgical specialty, medical specialty, cardiologists. You want to have a relationship with them, isn't it? That's really helpful. You want to communicate effectively with each other. So as part of the team, you need to know how you can communicate effectively. Uh, a lot of you might have heard about S-bar. That's the handover technique. Similarly, so it gives your communication needs to be structured. So when you're working in a high pressure situation, making time critical decisions, you need to have a structure. When you are communicating your ideas, your thoughts, you need to have a structure. Collaboration, like I said again, couldn't emphasize more. As emergency medicine, we need collaboration from other specialties. We can't do everything on your own. You might see a patient who is in a cardiac arrest. You might have revived that patient, but that patient ultimately needs the clot, coronary clot, to be removed. That can be done by the cardiologist. So if you're not collaborating with other specialties, it doesn't matter how much effort you put in. So what makes a high performing teams? Again, something it's more about a discussion. These sessions are more about discussion. But anyways, we will discuss, or I'll give you an insight of what high performing teams are made up of. I think there's no rocket science here. Very basic, simple ideas where you need to have trust within your team. We have already emphasized on the importance of communication. Uh, you need to have shared goals. That is very important. All of you or the whole team has to be working towards one common goal. And of course, you need to have mutual respect for your team members. Without trust, without respect, there's no team. So having mutual respect for each other, understanding each other's issues or shortcomings is vitally important. And of course, the other thing which in the middle, which I've left, I wanted to discuss this in detail, is a concept called psychological safety. I'm not very sure how many of you might have heard about this, but this was an eye opener for me. And when I reflected on some of the teams that I have worked with, I felt psychological safety was one of the most important aspect that you feel working in a team. Okay, so we will go in detail, bit more detail about the psychological safety as we move around. So when you are leading a team, when you are as a leader, obviously when you are starting to lead a team, everybody have their leadership style, right? Everybody have a different leadership values, leadership skills, and they also have a different leadership style. So, like I said, Daniel Goleman is one of the pioneers in this field. He's done a lot of research, and he came up with this idea of that there are 6 leadership styles that people adapt or people look for when they are looking at a leader. So, and every style have its own place when you are, especially in the healthcare sector or especially in emergency department. Every leadership style has its place. There's no one leadership style that dominates the other. It depends on the situation. So that's why a lot of people talk about the ideal leadership style in emergency is situational leadership, where you adapt your leadership style according to your team members, according to the task provided to you. So the leadership styles, 6 leadership style, which Daniel Goleman's talk about, is the cohesive, or it's more of a autocratic leadership, where you tell people what to do, straightforward. Again, like I said, it has its own place, especially in a crisis situation, especially if you're leading a cardiac arrest team or a trauma team. You cannot be democratic over there. You need to give clear instructions, create clear task to the people so that they can perform their duty. Then you have authoritative, which is more of a visionary. You tell people what to do, you take them through the vision. Okay, this is my vision, let's do this. You have affiliative, which is like people come first. So as a leader, you take a step back and you allow your team to take certain decisions or decide what to do. I think one of the most common things which we see this aspect in UK is what we call as self rostering. So people here are given an option of deciding when they want to work. That has such a positive impact on their work life balance, on their sustainability into the department. So they decide which days they are free to work, which days they might be busy, they might be having other functions, other priorities in their life. So people can decide when they want to work. So that's one example that came to me for affiliative. Then you have democratic leadership style. You have pace setting style, which is more like you follow me. Okay, so the difference between authoritative and pace setting is authoritative is a visionary. He gives you a vision, so try and achieve this. Like if I say that, okay, you need to come to, let's say you want to do a FR camp, so I can give you a vision. This is how you apply, this is how you do, this is how you come to the UK. So I can give you the vision, I can't take you there. The pace setting is something where you actually take them with you. As a leader, you take your team with you. You perform the task and tell them how, see, this is how it can be done. Then obviously you have the coaching. So again, these are like in detail discussion that ideally done in a more interactive way. But for today's session, I just wanted to glance through each one of these. Okay, the next important thing aspect of, like I said, communication, and with communication in team comes conflict. Everybody knows how irritating it is, conflict. Uh, A very common thing, you have conflict with many things, conflict with people, conflict with their decisions, conflict with their ideas. Uh, and it's bound to happen when you're working with different people. It's bound to happen. So this famous concept from Thomas and Kilman conflict model, which talks about how you can deal with or how you can manage conflict, especially when you're working within a team. So on the x-axis you have the cooperativeness, and on the y-axis you have the assertiveness. So the ideal thing is you'll have to find a balance somewhere in between. Okay, so if you're too cooperative, if your cooperation is like too low and you are not assertive at the same time, people will start avoiding. They will just avoid the situation. They will try and walk away from the issue. Okay, if you are too cooperative, if you're really high on the cooperativeness and low on the assertiveness, then you can become quite accommodating. And sometimes it is not always nice to be accommodating. Okay, so especially in a healthcare sector, the specialty might make a unsafe decision for your patient. You cannot be accommodating in that situation. You have to put your foot down and tell them, no, no, this is not safe for the patient. So accommodating is also not the ideal thing. Competing, obviously, if you're too assertive and low on cooperation, then it's become competitive. It becomes like challenging. Who will win? I want to win. Ideally, ideal team should be focusing on collaborating, where you have high assertiveness at the same time high cooperativeness. This is the ideal place to be in. uh, but again, there is also a place called compromising, where you will compromise, or you will come to a conclusion where both party feels that they are winning something. This is the same thing which we just discussed. This was the video which I wanted to share, but maybe some other time. So psychological safety, which I was talking about in the team, it is why it is vitally important. So this lady, basically, she is a professor in Harvard University. She's a psychology professor, and she came up with this idea. She's called Amy Edmondson. She is really famous in this field, and she has done a lot of work. And she introduced a concept called psychological safety, and this concept got uh, appreciation or recognition when Google did a large study on one factor which they felt is key to the high performing team, and it came out that psychological safety was that factor. So what exactly is psychological safety? Basically, it's a zone people will feel safe to discuss, or in a short word, high amount of trust between the team members. So we are not afraid to discuss our problems, our shortcomings. We are not afraid to discuss if we make any mistake. So when you create an environment which people feel safe in discussing their shortcomings, that's basically it's psychological safety. So the idea here is that you can speak up, you can share your ideas. It might be a good thing, it might be a bad thing, it might be absolutely stupid, but your team makes you feel safe so that you can share your ideas. Okay. Learning from mistakes. The next important aspect is learning from mistakes. So we all know, I mean, the single most reason we don't admit our mistakes is criticism, isn't it? Criticism or embarrassment. If we accept our mistakes, or if we expect our shortcomings, you feel that okay, people might embarrass you, you might not look nice. So removing that kind of mindset is very important, and that becomes one of the key aspect of building a psychologically safe environment for your team to work with. Inclusion and belonging. So everybody wants to feel included, isn't it? Like I'm doing this discussion, I want to feel included. People who are attending this session, they want to feel included in what we are discussing today. They want to feel belonged of what's happening within the team. So that's one of the other important aspect. Stronger teamwork. Obviously, you all want to work strongly within the team. Resilience and well-being, we are taking care of each other. We are taking care of each other's well-being. If somebody is too tired, if somebody has seen a lot of patients, you give them space. You say, okay, yeah, you go and take a break, have a bit of a drink, or just take a few minutes off so that you can uh, regenerate yourself. So all this aspect makes is combinedly together called as psychological safety, a key component in dealing with teams. Okay, so now we have understood what is leading yourself means, how to lead your teams, what issues can happen within a team, and now the ultimate goal is how you can lead the system. As a leader, as you grow, as when you're growing as a leader, this becomes more and more important. So at your earlier stages, leading self is the key. In your middle stages, or in a middle grade stage, leading or working within the team is important. And then as more senior you become, you are given responsibility of leading the systems. As you can see, as a clinician, as a doctor, you might have to deal with different kind of people, different kind of systems. And how would you do that? How would you approach these aspects, in short? So here comes the tree again, the fourth part, the canopy. So when you have strong roots, strong trunk, built nice branches, this is the time to reap the benefits. So you have a canopy, or you have all the benefits of building the core strong system. Healthcare system, in short, is everything is connected. Like I said, especially emergency medicine, it's not an individualized specialty. You have to work in a team, you have to work with different specialities, you have to be part of the system, isn't it? You have to be part of the system to execute your skills, basically. So you need to have systems thinking. So if you are taking a decision, you need to see what will happen next. I think the best example that comes to my mind is when we are resuscitating a patient. Here in UK, it's a very common thing, where people who are very elderly, very old people, we what we do is called do not resuscitate. So we discuss with the family and the patients and tell them that if in a situation where the heart stops, uh, what are the what are the pros and cons of doing a cardiac resuscitation. So in the UK setting, obviously this is about the utilization of resources, hospital beds, ICU beds. If the patient is resuscitated, a 90-year-old person is resuscitated who is on a ventilator, what is the outcome? So you need to develop this systemic thinking of what will happen, what is going to happen. Is there any benefit in that? Is there any will there be issues with resources? Obviously in Indian setting, it will be about a patient's ability to pay. uh, we all know how challenging that could be, and how it can lead to other issues. I mean, it can lead to violent issues that we have seen a lot of time in the Indian setting. So all these things, so you need to have that systems thinking of, okay, if I take a decision, what impact it will have on a patient, what impact it will have on the system, what impact it will have on the wider system, right? So you need to develop those systemic thinking. And obviously, when you do this, you want to know how you can improve things. That's where we come to the concept called quality improvement. I'm sure a lot of people of you have heard about this. Some of you might have not heard about this. Some of you have no idea what does it mean. Okay, so quality improvement is a process through which we try and improve our systems, how we work in a system, how we interact with the system, what changes can be brought. So quality improvement is one of the key aspect of healthcare system. I mean, the interesting story is this concept was not invented in healthcare system. It was invented in Japan by Toyota, basically. So people working at Toyota identified how they can make something repetitive. So they were building cars, obviously, and they were looking at how they can improve the performance, how they can improve the time set of uh, building or manufacturing a car. And that led to a concept called quality improvement, uh, and that was integrated into healthcare systems somewhere in 1980s. And since then it has become part and parcel of healthcare system. So if you want to bring any change, influence the system, improve the system, this is the way to do it. So this is considered as evidence based, research based. You develop a system through which you can assess what you're doing. Okay, so the five key components is obviously measurement. You want to measure what you are trying to improve. Then you try to understand the process, and once you understand the process, you develop a process, you implement that process. Okay, and once after that is done, you test. Once you have done something, has it improved anything, has it made any change? Like for example, from my personal experience, I did a quality improvement project on patients coming with high blood pressure to emergency departments. In UK, the system is different. High blood pressure or hypertension is managed mainly in the community, not in hospital. So a lot of people will end up to emergency department with high blood pressure, but again, they are not getting the right treatment because it is not part of the hospital system. So I did some data collection, implemented, advised some changes, and then we do another test where we test the change. It's called PDSA cycle. So you plan, you implement a change, then you study that change, and then act again. Uh, and then obviously you want to, what it will do ultimately is a sustaining improvement. So once you have implemented a process, you want to make sure that process is sustainable. You don't want to just do it for once, you want it to be repetitive. So that's quality improvement, and that's the idea of or a way to change the system or influence the system. This is another concept. I think we'll not go into details about this. It's called Kotter's 8 steps for leading a change. When you're trying to make a change, or when you're trying to influence the system in a certain way, there are few steps. Again, this is research based. How would you go about these steps is again a part of discussion in a different workshop maybe, but something to go about or read about. Then yeah, I think for me, like I said in the beginning only, culture is very important. As a leader, your role is to build a culture. That is your key aspect. Like there's this famous saying from Peter Drucker, who says that culture eats strategy every day. Okay, so you can make 1,000 strategies, but if you don't build a culture of implementing those strategies, it's not going to work, right? So as a leader, this is the chain of things that you need to do. As a leader, obviously you need to set the vision, then you need to behave like that. Okay, you need to have a bit of pace setting leadership here, where you want to set the goals, build the vision, create the goals, and set the goals, and start working towards that. So once people see your behavior, or as a leader, your behavior, but impact your team's behavior, and that ultimately becomes a departmental culture. I think a lot of research has gone here in UK. Probably again discussion for some other time, but they have how culture influences practices, even in UK or even in advanced healthcare systems. How culture can have a positive impact and negative impact both. One thing which through which you can build cultures, or as leaders, as people who are in leadership positions or higher positions or stronger position, is to build your team's leadership skills from the beginning. I always tell this to a lot of people. So as senior doctors, it's our responsibility to train our juniors, because tomorrow they would be our doctors. They would be the physicians who will be treating us when we become old, when we fall sick. So these are the people who are going to treat us. So if you don't embed that teaching, that skills in your juniors, you're I'm afraid you are asking for trouble when you grow old. So there are two ways to do that. Obviously, coaching and mentoring. Again, one of the big or famous concepts here in UK. You have coaching. I mean, I have during my leadership training, I had particular training to become a coach, how to coach people. Again, it's not uh, everybody don't have that skill. You can develop that. Obviously, you can develop that. You can explore that. If that is your hidden talent, you can obviously explore that. But you have a proper system through which coaching is taught, if that makes sense. So you have coaching, you have mentorship, both of these aspects. Yes, Atif.
Masar, I would like to take a couple of minutes in terms of
Sure.
what coaching is really. It is a different entity itself. Um, for the ease of explanation, what I would do is I would give an example of what a coach really is. So there are different things. Someone could be a coach, someone could be a teacher, someone could be a mentor, or someone could be something called as a supervisor. Say, for example, let's take an example. We often have handovers in emergency department between each shift. And you see one of the new doctors who's recently joined and is going to present his case to be able to, hand over to the incoming team. So a junior doctor usually struggles at handover. So if someone is a teacher, so how would a teacher say? A teacher would say, this is how you should structure a handover. This is how a teacher would teach. This is to the junior colleague. This is how you should structure your handover. If it is something like an educational supervisor or a clinical supervisor, they would say, your handovers need to improve and this will be reviewed. Okay. So they would call the junior doctor and say, this will be reviewed in our next supervisor meeting. Your handovers need to improve. A mentor is, he would say that I also struggled with handovers when I was a junior doctor. This is a common thing to happen. That's okay, no problem. So here comes the role of what is a coach. What a coach would do is he would take the junior doctor to a side place or a side room and say, right, what do you think makes your handovers difficult? Uh, what would a successful handover look like to you? What could you try differently next time? So this is what a coach really does, is sort of digging into the matter with the junior doctor or any other doctor to think about what problems they struggle with. And it is that kind of, very informal approach of what a coach really is. Uh, there's a lot can be taught about it, but I think coaching is a very good concept in emergency department that helps um, ED clinicians grow. And this is um, quite less spoken about in the Indian setting, but I think we should really push for what coaching is, because it's usually taken as a formal advice. But coaching is, for example, when I went to England, I had a coach who was a very senior, maybe 20 years plus experience more than me. And he was my personal coach. I used to work with him on the shop floor, but he gave me that personal advice that really made me improve in how I present myself. Just my views on that, Aman sir. Thank you. Back to you again.
Yeah, no, thank you so much, Dr. Atif. Yeah, this makes the webinar a bit interesting. Like I said, I think ideally this session should be in person as interactive discussion. But yeah, thank you so much for pitching in and again sharing your experience. Like I said, Dr. Atif just mentioned, a coach will take you and tell you how can I help you solve this problem. A mentor basically will share their own information. So you will, I mean, it's a very overlapping concept, but the idea is training or passing on our information or our knowledge to your juniors will help build a culture of leadership. Okay, I think we are coming to the end of our session. Yeah. So again, thank you so much, everyone. As part of Team Empower, me and Dr. Atif, we appreciate the opportunity given by Team Yashoda. I mean, like again, amazing team. The work you're doing is amazing. Giving these opportunities to your people. This is what exactly we are talking about: giving opportunity to learn. I think you are at the forefront of this idea, this concept. So thank you so much, the entire team, Dr. Srinath sir, Dr. Tejasvi. Again, great opportunity. Thank you so much. Looking forward to do similar things in the future. And we at Empower Academy, we have leadership workshops. If anybody is interested, more than welcome to contact us, and we will try and support you in any way we can. Great. Thank you so much, everyone. That's would be end from my end. Over to you, Dr. Atif.
Yes, thank you very much, Mansur, for taking this talk. And thank you to SEMI, especially the organizing team. I can see some names: Dr. Sravani, Dr. Saikiran, Dr. Malaya, as well as Tejasvi. Thank you for giving this opportunity. I luckily happened to be in Hyderabad, and I got in touch with Tejasvi, and just one click, and he said, yes, of course, you can do the presentation. And of course, organizing chairperson, Dr. Srinath sir, thank you so much. And the entire SEMI team. It's been a lovely evening today. And we hope to do more and more presentations and share our experiences from abroad for the Indian setting. And best wishes on behalf of Empower Academy to all the upcoming and budding emergency physicians. Have a good evening, everyone. Thank you so much.